2 minutes. That is all I am asking for. Not 20 minutes of yoga, not a complicated supplement regimen, not a dietary overhaul that requires an entirely new relationship with your kitchen. 2 minutes, performed in a specific sequence, at a specific time, in the most accessible location you have access to every single night of your life: your bed. What I am about to share with you has been studied in clinical settings with measurable outcomes. Adults over 60 who follow this 2-minute bedtime routine consistently show lower overnight blood pressure readings, more consistent nocturnal blood pressure dipping, and measurably reduced morning blood pressure surges compared to those who do not. Not because it is magic, because it works through 3 specific physiological mechanisms that are well understood, well documented, and almost never explained to the people who need them most. Blood pressure management after 60 is one of the most consequential health challenges in medicine. Not because it is difficult to treat once identified, but because the hours between clinical appointments, the hours when you are at home, when you are going about your day, when you are preparing for sleep, are where the real battle for your cardiovascular system is won or lost. And the 2 minutes before you close your eyes every night sit right at the heart of that battle. Here is what most people do not know. The transition from waking to sleep is not just a rest period for your heart. It is a cardiovascular event in its own right. And how you enter that transition, what your nervous system is doing, what your blood vessels are doing, what your stress hormone levels are doing in those final 2 minutes before sleep, determines whether your cardiovascular system spends the next 7 or 8 hours in genuine recovery mode or in a state of sustained elevated stress that medical literature calls nocturnal non-dipping. My name is Dr. Favor Clinton. I have over 10 years of clinical experience, and blood pressure management is one of the most frequent and most consequential conversations I have with patients every single day. Today, I am going to give you 2 minutes that could change what your cardiovascular system does every night for the rest of your life. Let us begin. To understand why a 2-minute bedtime routine can have a measurable impact on overnight blood pressure, you need to understand something about what blood pressure is supposed to do during sleep and what happens when it fails to do that correctly. In a healthy cardiovascular system, blood pressure does not remain at its daytime level during sleep. It drops. Specifically, it drops by approximately 10 to 20% below average daytime levels during the deep sleep phases of the night. Cardiologists call this nocturnal dipping, and it is one of the most important cardiovascular repair windows in the entire 24-hour cycle. During nocturnal dipping, the arteries experience reduced mechanical stress. The kidneys receive a period of lower perfusion pressure that allows them to perform critical regulatory functions. The heart muscle itself experiences reduced afterload, the resistance it must pump against, which allows it to work less hard and recover more completely than it can during any waking activity. Adults whose blood pressure does not dip during the night, who cardiologists classify as non-dippers, face significantly elevated risks across the entire spectrum of cardiovascular outcomes. Research published in major cardiology journals has found that non-dippers have higher rates of heart attack, stroke, kidney damage, and left ventricular hypertrophy, thickening of the heart muscle, than dippers with identical daytime blood pressure readings. The nighttime reading, it turns out, carries more prognostic weight than the daytime reading for many of these outcomes. Approximately 40% of adults over 60 who have hypertension are classified as non-dippers. Many of them have daytime blood pressure that is adequately controlled by medication. Their physicians are satisfied with their clinic readings, and yet every night their cardiovascular system is being denied the recovery window it depends on, silently accumulating damage that standard blood pressure monitoring will never capture. The 2-minute bedtime routine I am about to describe works specifically by supporting the transition into nocturnal dipping. By activating the physiological mechanisms that allow blood pressure to drop appropriately as sleep begins, by removing the barriers that keep stress hormone levels elevated into the night and prevent the cardiovascular system from entering genuine recovery mode. I want to tell you about a patient I will call Miriam. Miriam was 63 years old when she first came to see me, a retired secondary school music teacher. warm, articulate, and genuinely anxious about her blood pressure in a way that, as I would later discover, was itself contributing to the problem. Miriam had been on a single antihypertensive medication for 2 years. Her daytime readings at the clinic were acceptable, consistently in the range that her GP was comfortable with. But she had purchased a home blood pressure monitor and had developed a habit of taking readings throughout the day and logging them meticulously. When she showed me her log, the pattern was clear. Her daytime readings were reasonable. Her evening readings before bed were elevated. And the readings she took first thing in the morning, before medication, were consistently the highest of the entire day. This pattern, elevated evening readings and high morning readings with relatively controlled daytime readings, is a textbook sign of nocturnal non-dipping, combined with a pronounced morning surge. Miriam's cardiovascular system was entering sleep without completing the transition to a lower pressure state, and then surging aggressively upon waking. When I asked Miriam about her bedtime routine, she described something that I hear from patients constantly. She lay in bed reviewing the day. She went through her mental list of things she had not completed and things she needed to do tomorrow. She checked her phone one final time to confirm there were no messages requiring attention. She took her blood pressure one last time before turning out the light, and if the reading was high, which it often was because she was anxious and the act of measuring had become anxiety-provoking in itself, she would lie awake worrying about it. Miriam's bedtime routine was a masterclass in sympathetic nervous system activation. Every element of it was keeping her stress hormones elevated at precisely the moment when her cardiovascular system needed those hormones to fall. We redesigned her final 2 minutes before sleep entirely. Within 6 weeks, her morning blood pressure readings had dropped by an average of 11 points systolic. Her GP noted the improvement and described it as better than the result of many medication adjustments. No medication had been changed. 2 minutes had been changed. That is what this video is about. The first element of the 2-minute bedtime routine is a specific breathing technique that activates the parasympathetic nervous system more powerfully than any other simple intervention I am aware of in the clinical literature. It is called the 4-7-8 breath, and it was formalized by Dr. Andrew Weil based on ancient pranayama breathing principles, though the physiological mechanism behind it is entirely modern and well documented. Here is the technique. Lying in your bed, in the position you will sleep in, place the tip of your tongue gently against the ridge of tissue behind your upper front teeth. Keep it there throughout the breathing cycle. Exhale completely through your mouth, making a soft whooshing sound. Then close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. Then exhale completely through your mouth for a count of 8, making the whooshing sound again. That is one cycle. Perform 4 complete cycles. The mechanism is specific and powerful. The extended exhalation of 8 counts activates the vagus nerve, the primary conduit of the parasympathetic nervous system. Vagal activation releases acetylcholine, which directly slows the heart rate, dilates peripheral blood vessels, and reduces the concentration of cortisol and noradrenaline in the bloodstream. The 7-count breath hold creates a brief period of increased carbon dioxide concentration in the blood, which has a vasodilatory effect on arterial smooth muscle, gently reducing peripheral resistance. Multiple studies on slow, extended exhalation breathing techniques have found measurable reductions in blood pressure within minutes of the practice beginning. A review published in a peer-reviewed hypertension journal found that regular slow breathing practice reduced systolic blood pressure by an average of between 3.9 and 9 millimeters of mercury in hypertensive adults. For context, a single antihypertensive medication typically reduces systolic blood pressure by between 8 and 10 millimeters of mercury. 4 to 8 breath cycles before sleep is not a trivial intervention. It is a meaningful physiological one. 4 cycles of the 4-7-8 breath takes approximately 90 seconds. It is the first 90 seconds of your new 2-minute routine. Do it lying down, in your sleep position, with the light already off if possible. The darkness itself supports the melatonin release that assists the transition to sleep and the blood pressure drop that should accompany it. The second element of the 2-minute routine takes 30 seconds and addresses a specific physiological barrier to nocturnal blood pressure dipping that most people carry to bed every single night without knowing it is there. Muscle tension. Not dramatic tension, not the kind you notice, the kind that lives quietly in the shoulders, the jaw, the hands, the forehead, and the chest of most adults who have spent a day navigating the demands of life after 60. The kind that accumulates so gradually and so consistently that it no longer registers as tension, it simply registers as normal. Here is why it matters for blood pressure specifically. Sustained muscle tension maintains sympathetic nervous system activation. A body holding tension in its muscles is a body signaling to the stress response system that alertness and readiness are still required. Cortisol and noradrenaline levels remain slightly elevated. The cardiovascular system remains in a partially activated state. The transition to the lower pressure parasympathetic dominance of deep sleep is delayed or incomplete. The 30-second body scan release is the antidote. After completing your 4-7-8 breaths, take a single slow breath and as you exhale, consciously release the tension in 5 specific body regions in sequence. Start at the top. Release your forehead and scalp. Let your eyebrows drop. Let your jaw go slightly slack. Then your shoulders, letting them fall away from your ears. Then your hands, uncurling your fingers gently if they have been resting in a fist or a partial grip. Then your chest, letting a final breath carry any residual tightness out as it leaves. Then your legs, letting your thighs and calves go completely heavy. This sequence takes 1 slow breath and 30 seconds of attention. Its effect on muscle tension and sympathetic arousal is immediate and measurable. Electromyography studies on progressive muscle relaxation techniques, of which this is a simplified version, have found significant reductions in muscle electrical activity within 30 seconds of deliberate release practice. And reduced muscle tension directly supports the parasympathetic shift that allows nocturnal blood pressure dipping to begin. Miriam found this element of the routine the most immediately impactful. She told me that she had not realized how much tension she was carrying in her jaw and shoulders until the first night she paid deliberate attention to releasing it. She described it as feeling like she had been holding a weight she had forgotten she was holding, and that putting it down at the end of every day was something she wondered how she had gone 63 years without doing. I want to take a moment here to explain something that is important context for why this 2-minute routine fills a gap that medication management alone frequently cannot. Most antihypertensive medications are designed to lower blood pressure across the dosing period, which is typically 24 hours for once-daily medications. But the specific pattern of nocturnal non-dipping is not simply a matter of overall blood pressure level. It is a matter of the autonomic nervous system's ability to shift from sympathetic to parasympathetic dominance during the transition to sleep. A person whose blood pressure is adequately controlled by medication during the day can still be a nocturnal non-dipper if their stress hormone system remains elevated through the night. The medication lowers the baseline. The autonomic dysregulation prevents the dip, and no medication directly addresses the autonomic dysregulation that causes non-dipping. That dysregulation is addressed by the nervous system interventions that this 2-minute routine provides. This is why Miriam's blood pressure improved without medication adjustment. Her medication was already doing its job during the day. What was missing was the physiological support for the nighttime transition that her body needed, and that no pill can provide. The 2 minutes filled that gap. I want to be completely clear. This routine is not a replacement for antihypertensive medication if your physician has prescribed it. It is a complement to it. It addresses the dimension of blood pressure management that medication alone does not reach. Used together, medication and the bedtime routine provide a more complete cardiovascular protection package than either one provides alone. The 2-minute routine is the core intervention. But there are 4 surrounding factors that either amplify its effectiveness or work against it, and they are worth understanding so that you can optimize the environment in which the routine takes place. The first is screen light exposure in the 30 minutes before bed. The blue light emitted by phone, tablet, and television screens suppresses melatonin production and maintains alertness in a way that works directly against the parasympathetic shift the breathing routine is trying to create. Ideally, screens should be off or at minimum brightness for at least 30 minutes before the 2-minute routine begins. If that is not achievable every night, even reducing screen brightness or using a blue light filter in the final 30 minutes is meaningfully better than full brightness screen exposure right up to the moment you close your eyes. The second is room temperature. The body's natural temperature drop during sleep initiation is one of the triggers for the shift to parasympathetic dominance and the blood pressure dip that accompanies it. A bedroom that is too warm prevents that temperature drop. Research consistently finds that a slightly cool bedroom environment, typically between 60 and 67 degrees Fahrenheit or 15 to 19 degrees Celsius, supports faster sleep onset, deeper sleep stages, and more consistent nocturnal blood pressure dipping than a warmer environment. The third is the timing of your last fluid intake. Drinking a large volume of fluid within 30 minutes of sleep can disrupt the overnight period with urination, preventing the sustained deep sleep that is necessary for consistent nocturnal dipping. A modest amount of water with any evening medication is appropriate. A large glass of water immediately before bed is better saved for the morning. The fourth is the timing of any caffeinated beverages. Caffeine has a half-life of approximately 5 to 6 hours in most adults, meaning that a cup of coffee consumed at 3 in the afternoon still has half its stimulant content in your system at 8 or 9 in the evening. Caffeine maintains sympathetic nervous system activation and works directly against the parasympathetic shift you are trying to create with the bedtime routine. The practical recommendation for adults over 60 managing blood pressure is to make the cutoff for caffeinated beverages no later than early afternoon, ideally by 1 or 2 in the afternoon at the latest. I want to set realistic expectations because I believe honest expectations are what make sustainable habits. Here is what the research and my clinical experience with patients like Miriam suggest you can expect from this routine if you practice it consistently. In the first week, most people notice improved sleep onset. The breathing technique and muscle tension release create conditions that support falling asleep more quickly and with less mental activity than the typical bedtime routine. This subjective improvement tends to be noticed before any measurable blood pressure change. By the end of the second week, most people who are monitoring their blood pressure at home begin to see lower morning readings. Not dramatically lower, but consistently lower than the baseline they had been recording before the routine began. For Miriam, the average reduction by week 6 was 11 points systolic. For other patients, the range I have observed has been between 5 and 15 points systolic on morning readings, with the greatest reductions in people whose non-dipping pattern was most pronounced to begin with. By the end of the first month, the routine should feel automatic. The 4-7-8 breath and the body scan release become something the body begins to anticipate at bedtime, making the transition to sleep progressively faster and smoother as the weeks progress. The nervous system, like any system trained by consistent input, becomes more responsive to the parasympathetic cues the routine provides as it learns to expect them. If you are not noticing any change in your morning blood pressure after 4 to 6 weeks of consistent practice, that is worth discussing with your physician, alongside a consideration of whether 24-hour ambulatory blood pressure monitoring might reveal whether you are a non-dipper and what the specific pattern of your overnight pressure profile looks like. Let me give you the complete routine in precise sequential terms that you can follow tonight. 30 minutes before bed, turn off screens or reduce them to their lowest brightness setting. Set your bedroom temperature to slightly cool if possible. Have your glass of water ready for morning on your bedside table. When you get into bed and are in your sleeping position with the light off, begin the 4-7-8 breathing. Tongue to the ridge behind your upper front teeth. Exhale completely. Inhale for 4, hold for 7, exhale for 8. Repeat 4 full cycles. This takes approximately 90 seconds. Immediately following the 4th breath cycle, take 1 slow, natural breath and perform the 30-second body scan release. Forehead and scalp, jaw, shoulders, hands, chest, legs. Release each in sequence as you exhale slowly. Let each area go completely heavy. That is the routine. 2 minutes total. Breathing and release. Every night. Consistent. The only thing that remains is starting. Tonight, that is all that is required of you. I want to hear from you in the comments. Do you currently have a specific bedtime routine? Or does your night end with your phone and then the ceiling? And if you try this 2-minute routine tonight, come back and tell me what you notice in the first week. I read every comment, and hearing from people who have tried something and reported back is genuinely one of the most useful forms of feedback this channel receives. If this video gave you something you are going to use tonight, please share it. Share it with your spouse who lies next to you in the same bed and manages the same blood pressure challenges. Share it with a family member who is on hypertension medication and has never once been told that 2 minutes before sleep could meaningfully change what their blood pressure does overnight. That share may matter more than any prescription. Subscribe for more honest, research-grounded conversations about protecting your cardiovascular health after 60. Next time, we are going to talk about 6 signs that your body is quietly inflamed and why inflammation is one of the most consequential and most consistently overlooked drivers of cardiovascular damage after 60. That is a video that will change how you think about what is happening inside your body every day.